Hi, in today's video we're going to be talking about the Crisalix morphing software, which is so useful for us plastic surgeons. I'll tell you how is this software so useful. It essentially takes in the pictures of the patients, and you can do so many things, which you can do some volume rendering, you can do some additions, you can change some parts of the body, and what you're planning to do that can be shown to the patient in real time, and then the patient kind of accepts whether she likes or he likes that particular change, and once that particular change is done, we can kind of get into an agreement with the patients. Now, there are three types of softwares which are focusing on the face, the breast, and the body. Now, as plastic surgeons, we do a lot of surgeries on the face, and we also do a lot of surgeries on the breast as well as on the body. Now, a lot of our patients, when they come to us, they ask us, especially when a patient undergoes a rhinoplasty, how am I going to look? So this is one such tool where you can take pictures of the patient, feed that into the software, and then you can actually get the desired changes. Let's say a patient wants an enlargement of the nose or a reduction of the nose. That can be done in the software and shown to the patient. Similarly, if the patient has a very bulky tip, how it looks when it is narrowed down or softened. So especially when we are considering, let's say, a change in the patient's nose. So our patients, they opt for enlarging the height of the nose, and then some of them might opt also for reduction of the nose. Some patients might opt for the tip corrections. So all these things can actually be done on the software, and we show our patients how they're actually going to look based on our plan. Let's say if our plan is to put an implant, we feed the patient's picture into the software, and then it shows exactly in real time. Let me just show you how the morphing software is going to actually look. Now you have this image of this patient, and all this is in 3D. So you can actually look at the patient's face from all angles. You can turn over, see how the tip is looking, and see how the nose is looking from the profile, and also from below. So everything is there, and so many tools which you can actually incorporate into this. Basically educating our patients and trying to show to them what they're going to look like. Now, let us talk about what is the scope of the Crisalix software. Now, when it comes to the face, now you have so many surgeries which we plastic surgeons do. Now, the common surgeries which we do are the facelifts, the neck lifts. These are something which we can put in the software and get the imaging how it's going to look. Prominent ears, once you reset them back, you can make our patients see their images. And then you also have things like textural changes in the face. When you're doing a chemical peel, when you're doing a laser, all that can be shown for our patients. Not only these surgeries, but when you're trying to volumize something, when you're trying to volumize the cheek, trying to volumize the chin, let's say you're using an implant or a filler, you can actually show the patient how they look like before even they undergo a filler surgery or a implant surgery. Removal of a mole, you can just remove that particular aspect and see how the patients are feeling even before they're getting their mole removed. So we talked about so many aspects of the face. Now when it comes to the breast, the main types of surgeries which we do as plastic surgeons are breast enlargement. Now again, breast enlargement patients are wanting to know how is it that is going to, whether it's going to match, whether the implant which you have chosen is going to match. So what we do is take the pictures, feed it to the software, and then the software renders many images depending on what are the volumes we choose. So let's say a patient is wanting a 300cc implant. So we choose a 300cc implant and show the image to the patient. If the patient says this image is too large, so maybe we know that 300cc implant is not the correct thing she's looking at, and maybe we downsize it to maybe 240 or 220 or 260, and again show those images. At one point of time, our patients will probably choose the image which is more suiting them. So we are on the same page. When we are actually explaining to the patient, we tell them that this is probably the best implant we need to use, and usually, I mean, it turns out to be a good fit for the patient and they're extremely happy. So breast augmentation, definitely Crisalix is the way to go forwards. Whenever you want to explain to the patients, when you want to have a better understanding what their expectations are, so that post-operatively or after the surgery they are very, very happy. Breast lift is another surgery where again we can take advantage of the software. Breast reduction, how much is going to reduce, where the scar is going to be, all this can be shown on the Crisalix software. Even gynecomastia surgery, they also can be shown on the software. So coming to the body, now body there are different procedures we do. One is the liposuction. So because of the Crisalix software has a volume rendering, we can exactly calculate how much of volume is there in the particular aspect of the abdomen, and then we try to remove that volume and see how the patient looks. So when it comes to liposuction of various parts of the body, that's again can be shown. Six-pack surgery, something which can again be simulated in the software and so on. So it is nothing but a tool where we plastic surgeons get a better understanding of our patients' requirements, and even our patients can understand us better because they know that this is what the doctor is going to do. So less amount of post-operative problems with our patients in terms of what the expectations they were and what they were actually thinking about. So all that can be reduced with the Crisalix software.